What are the chances then of a non-melanoma leading to an actual melanoma diagnosis?
So, in order to understand the types of skin cancers, it's important to know that there are different cell layers within the skin. So, there are the squamous cell layers, there are the basal cell layers, and there are the melanocytes. And melanocytes are the cells in the skin that give us our skin color. It's the pigment that causes our skin to be either light or dark. So, having one type of skin cancer, like a basal cell, for example, that cancer originates from the basal cell layer of the skin. So there is no way for a basal cell cancer to convert into another cell type. So if you have a basal cell cancer or a squamous cell cancer, it will not turn into another type of skin cancer. So having a basal cell or a squamous cell does not convert or change into a melanoma. However, there are some types of skin cancer that under the microscope, when the pathologist, who is the doctor diagnosing the skin cancer by looking at it under the microscope, sometimes it's challenging to determine, is the cancer arising from or starting in the basal cell layer or the squamous cell layer. So every once in a while, patients will present to our clinic and it's a basal squamous or a basaloid squamous cell cancer. In other words, the pathologist is having a very difficult time determining which cell origin the cancer comes from. For most individuals, the treatment is the same. It would be surgically removed or excised. So for all intents and purposes, it doesn't always matter in those particular cases which cell type it is, but it is important to understand an individual's risk for additional cancers based on the type of skin cancer they were already diagnosed with. And what I mean by that is basal cell cancers are the most common type of cancer within humans. So we expect people to have, especially if you're lighter skin, to have a basal cell in the lifetime. About 1 in 5 individuals will have a skin cancer in their lifetime. So if somebody's had a basal cell cancer, then we would expect them to be diagnosed with another skin cancer at some point in their life, as we talked about earlier. If an individual's had a melanoma, then they are, again, at greater risk for having another melanoma, but more typically we see that they would be more likely to be diagnosed with a non-melanoma skin cancer. So to the original question, Lisa, we do not see one type of skin cancer converting into another type. That's just not possible based on where it's originating from.